Okay, I'll begin the recording. I want to thank everybody for joining us this morning. Appreciate your interest, and we hope that this short presentation will help with your decision to take part in this new funding opportunity. So let me begin the presentation. So we have a small group this morning. Can everybody see my screen? Okay. The this morning's agenda would be welcome and introductions first. So since we have a small group, would we like to do that? Does everybody know each other? Having trouble with my computer. I think my computer is frozen. Can you hear me?
I can hear you, Ginger.
Okay.
Are your slides not moving?
Yeah, they're not moving them. Let's see. Okay, there they go. All right. Can you see the agenda?
Nope.
No, you can't. All right.
You may have to stop and reshare.
Yeah.
There you go. It's on introductions now.
It's on introductions. Okay. All right. So the is it on community engagement and outreach grant contract review?
It's still on the same slide, introductions.
7-6. Now what is it on?
It has not moved.
I'm so sorry.
Do you want to stop sharing and then reshare?
Yes, thank you.
So we can still see your screen.
Okay. Can you see the agenda now?
Yep.
Okay.
Now we see your presenter view.
Okay. All right. So the grant that
So
we're going to-
Ginger, we're seeing
Yes.
your presenter view.
You are? I didn't even think you could see it.
You want to just end your slideshow? Yeah, you can just go from there. I think that's fine.
Okay. So if I put it on presenter view, you can see my notes.
Correct.
You can see my notes now.
Correct.
Okay. Well, I'll just try it like this. So the Tennessee Breast and Cervical Cancer Program, or TBCSP, is a statewide program that everyone that received the invitation is currently in. And I wanted to give some background information and history about the National Breast and Cervical Early Detection Program. It's a federal program under the CDC. It provides funding to TBCSP. It is for the purpose of breast and cervical cancer screening and diagnostic services to low-income and uninsured and underinsured women. It started in 1991. It served more than 5 million women and diagnosed 60,000 breast cancers, 21,000 breast lesions, invasive cervical cancers, almost 4,000, and precancerous cervical lesions, over 175,000. Although it's provided services to more than 5 million women since 1991, there remains a significant burden of breast and cervical cancer with inequities among certain populations. The new program activities that began in 2016, when the CDC began to explore untapped opportunities to reach women in need of screening, especially low-income women. They now expand the scope to include this particular contracted services scope. So they've implemented patient and provider evidence-based interventions, help connect women in communities to clinical services, increase opportunities to access screening, enhance the targeting of women in need for service. And the goal is to reach more women and make sure women are getting the right screening test at the right time. This particular helpful media is very interesting to me because it depicts the approaches that the CDC has taken to link the priority women to clinical screening services. And they have various approaches, and we are under the approach of health system interventions and provider focused activities, including helping with direct service delivery and enhancing service delivery. The Tennessee Breast and Cervical Cancer Screening Program aims to improve health equity through prioritizing evidence-based outreach to disproportionately burdened populations and communities defined as high risk. The scope of service and evidence-based intervention activities under this grant contract is outlined by the National Breast and Cervical Cancer Program. So what that means is that if there are any changes to the scope of services, it would come directly from the National Breast and Cancer Early Detection Program. A fact about breast cancer after this program was implemented was that the cancer death rates among women have decreased about 2% per year since 2003 through 2012. Experts believe it's a result of increased screening and awareness efforts as well as improved treatments. Screening detects cancer at the earliest stage when it is easier to treat. So now we will get into the scope of services and the deliverables of this particular grant contract. The goal of this grant is to improve health equity in breast and cervical cancer and diagnostics through these activities, increasing access to needed breast and cervical services by providing barrier reduction, increasing community engagement through education and outreach to populations disproportionately burdened by breast and cervical cancer, increase the number of patients that are provided screening services related to breast or cervical cancer by removing barriers and decreasing missed opportunities for screening, increasing access to timely screenings and follow-up related to breast or cervical cancer by providing patient navigation. The service recipients or the target population for this contract are uninsured or underinsured women who are at or below 50% of 250% of the federal poverty level. For breast cancer services, they should be between ages 40 and 64. And for cervical cancer, it would be screening services would be between 21 and 64. Anyone who participates in this would then provide a baseline of your population, what they look like, and their screening rates as a baseline. And so it's just important to remember who we're serving in this grant. The program activities are, there are 4 options. And the first option is barrier reduction activities, which would be the activities where you would help your patients with transportation, pay for child or adult care, copay assistance, providing vouchers, reimburse costs to remove any barriers that would keep them from coming because of not having any money to get there, and additional access to resources to increase the screening in underserved areas. There will be a barrier reduction report, so we would be collecting data ongoing throughout the grant period. Community engagement through outreach. We have increased community knowledge of breast and cancer, specifically involving client interaction, screening, or enrollment into applicable programs. Activities include, but they're not limited to, group education, where you would go on site, maybe working with local churches or any other community business that would be willing to host an event and provide the education. And it will also include if you would like to create small media. And there is actually a CDC sponsored source where media material is already available. It's called Make It Your Own, and I checked it out on their website. It's a really cool website, and so you really wouldn't have to be spending time creating things. And then there's reporting on that data too. So that data would need to be collected of who is being reached through option number 2. Option number 3 is the 4 evidence-based interventions that would increase or are proven to increase the overall number of women screened, improving clinic-level breast and cervical cancer rates, and strengthening the delivery of cancer screening. There is an excellent guide. It's a site called the Community Guide for these evidence-based planning interventions that it just goes from A to Z on how to do it. And I would recommend using those if you are going to be choosing option number 3. And one of the things about doing evidence-based interventions is that you can get even higher screening success rates by combining them together. And there's a lot of data on that too about using multi-component interventions. So another guide that I'd recommend is the Quick Guide to Planning and Implementing Selected Activities, which was created by the National Association for Breast and Cancer Early Detection, screening for early detection, in early detection. This is the community guide's one page. I wanted to put this up here because it does encapsulate how in multi-component interventions increase screening rates. They said here major finding was that 6.2% percentage points increase when compared to no intervention at all. And the cancer screening interventions by strategies, you see that down here it has increased community demand. So you could do group educations, client reminders, mass media, small media. You can increase community access by helping to reduce client out-of-pocket costs, and structural barriers that we haven't talked about yet. And then increasing provider delivery. You have provider reminders, provider incentives, and provider assessment and feedback. When you're implementing an evidence-based intervention, the first thing that you do is you basically do a readiness assessment to identify which evidence-based interventions would help a particular, clinic or program to improve their cancer screening rates. And that would involve reviewing patient flow and clinic protocols to identify missed opportunities for screening, review current clinic environment, the capacity, and any gaps that you have in referral screenings, and determine where improvement is needed. You'd review your existing practices on timely screenings for age-appropriate patients. And then you'd review, so if you're using an electronic health record to capture the data on screenings, and if your electronic record has the capacity for client reminders or provider reminders, then this grant will also pay for having those things turned on or modified in your system. So during this assessment, if you should happen to have an issue with an electronic record, that would, then bring that into being considered as part of your implementation. And then you would determine your clinic's baseline screening rate, which is the number of screenings divided by the number of patients that are eligible for those screenings. And then you would have an implementation plan. You would identify again and describe what the intervention would be and the interventions that were selected, if there were going to be any potential barriers or challenges before you implemented it, what resources you had available already to implement it, and then any communications with any health system partners. And that would be including Tccn to help and assist in any way in implementing the EBI, implementation of support for success. So who would be supporting this? Staff, other community partners, collection of the baseline data and then annual data ongoing. How would you be doing that? Evaluation and revising of the EBI implementation plan based on feedback. So as you implement it and along the way, would there be any changes that you would be needing to make based on feedback, and how would you be collecting the feedback? And then how would you sustain this? This is one thing that they're incentivizing, that after the grant is over, then you would receive future incentives to maintain that evidence-based intervention that you implemented. Option 3, types of evidence-based interventions. We have the provider reminder system, which works with helping to identify the patients that are coming up for a screening date, that it would alert the provider, maybe just during a regular physical, for example, that, hey, you know, this patient is now, they have a due date for screening, and then remind the client that it is time for screenings. This, I have a slide on Screen Out for Cancer, but all of these interventions, how to implement and deploy them. The Screen Out for Cancer website, which is through the CDC, has all of these, has much more information on how to do this. Provider assessment and feedback system. The goal is to motivate your providers to increase cancer screenings. And you can do that by developing a feedback system to say, hey, look, you know, we had this many patients that were in need of screenings, and this is how many were recommended for screening, and can track that and then help increase the recommendations for screening. And then there are client reminders. The goal is to prompt the patient to come to their screening appointment. And these can be letters, postcards, emails, messages through a health system or an EHR portal, and telephone messages, directly calling them, texting them, automated messages. One of the things about these interventions is that there are stories and examples of how other clinics implemented them. And there was one about a postcard reminder, that the postcard was on, it was pink, which made it stand out in the mail. And they got quite a response in just what the color of the reminder card was. Identifying and implementing evidence-based interventions also includes reducing structural barriers, and that would be the the non-economic obstacles for the patients. So you could modify your hours, offer services in non-clinical settings like mobile mammography vans at work sites or in residential communities, and eliminating or simplifying administrative procedures like offering scheduling assistance or patient navigation, transportation, all those types of things. And then the reporting of EBI implementation includes identifying your start date, and then using a SMARTY objective. And on the next slide, I have a focused on the SMARTY objectives, but you can get all of this information out on the national site on how to create a SMARTY objective. But identifying activities and the person responsible goes in your implementation plan, as well as any resources that were currently available. So on SMARTY objectives, of course, everyone's, familiar with the acronym SMART for specific, measurable, attainable, relevant, and time-based. But SMARTY objectives include the I and the E, which focus on those populations that are, disproportionately screened. And so it's inclusive and equitable. And so when we're writing an objective, you're including how it would include the equity and inclusion. And then option number 4, which is patient and client navigation. And some programs have used their community health workers as patient navigators to help them navigate the system in order to get a screening. But this grant does pay for help with, staff time providing these services. So patient barriers that they'd help navigate them through are lack of transportation, lack of care, not understanding why they should be screened, translation services, the mistrust of the healthcare system, actually educating them and helping them by building a level of trust, and then helping them also through questions about cancer and cancer treatment today and the success rate with cancer treatment. So at a minimum, client navigation, it would need to be documented, and you would document everything on this list. So assessing their barriers, helping resolve the barriers, including language interpreters, track and follow them, and monitor compliance with referrals, screenings, diagnostics, or treatment, provide education and support, assess whether they already have a primary care, and then refer as needed, and then document any barriers, the resolutions, and other assistance. This is a really good slide from the CDC on just basically evidence-based strategies and how the activities together work together for the short-term and the intermediate outcomes. So you see patient navigation and community outreach, how they work together with patient reminders, reducing barriers, using media, education, and then up at the top there under activities, you have provider assessment, provider reminders, helping reduce costs, and patient reminders. Outcomes include increasing provider recommendations for screenings, improving provider knowledge and adherence to the preventative task force, and increased demand for screenings among the priority populations, increased access, and then improved patient knowledge. And then intermediate outcomes would be increased patient completion of the screenings, and then increased health system cancer screening rates. I wanted to switch over now to talking about costs, allowable and non-allowable costs. I have some examples here. So allowable costs underneath this grant include supplies, developing and printing small media materials for education in the community, which leads to enrollment in the clinic and scheduled meetings. They'll pay for laptops, cell phones, staff time, consultant time, like I talked about that example of if you needed to make any programming changes to your EHR. And it also pays for some training, such as they have had breast cancer navigator conferences before. TDH has provided those. Non-allowable costs are construction, any alteration or maintenance of buildings or building space, food and drinks, research projects, lobbying, clothing, permanent equipment, and anything considered medication is not covered, or advertising materials, including goods with program name that have not been pre-approved by TDH. And so that goes back to making sure that you are using materials for evidence-based practices or interventions that have already been approved by the CDC. And then, of course, it doesn't pay for any large ticket items. This was the schedule of events. So we issued the RFA back in May. Today's our meeting. The application deadline is next Friday, 6/9. We will review the applications and then we will email the sub-award notices and contracts by the 26th of this month. And then we'll return the contracts on the 30th. And the effective start date of the grant contract is July 1st. The last slide here is the, when I talked about this screen out for cancer, one of the things again is that going back to a clear message of cancer prevention through cancer screening, and that the ultimate goal is simple and clear: to screen out cancer. And the tagline, advancing cancer prevention nationwide. And so anyone who is interested should really take a look at that website. It is a very interesting website. And then that concludes the presentation. So I'd like to, at this time, if anybody has any comments or questions that we'd like to talk about and discuss.
Ginger, can you stop sharing your screen? There
Thank
you go. Great. We can see each other.
Hey guys, just to confirm, this is Sherry. So this is for the $5,000 grant, is that right?
Yes.
Okay. There's two NAFC breast cancer screening grants, and I'm just getting myself confused. So this is the 5,000. Okay, got it.
Yes, ma'am. Yes. And there's only a requirement to implement one of the activities. And again, they are recommending, if you're doing evidence-based, that it would be a multi-pronged approach, especially if you're trying to increase your cancer screening rates. But yes, implementation of one activity.
And Ginger, do you want to just talk about sort of how we arrived at the 5,000 and how that might vary depending on who and how many organizations apply?
Yes, right. Absolutely. So we started out with all of the providers that are currently under the Tennessee Breast and Cancer Screening Program. And of those, we've received the number that we've received does not equal the number that we sent out. So it very well could be that the amount of the grant award could be more depending on how many clinics, how many of our members are interested.
And Sherry, I know you all are in process of getting registered with the state. Do you have an idea of when that will be done?
Hopefully in the next week or two, we should be complete with that.
Okay,
We
perfect.
submitted that at the end of last week. So I think there's probably like a 2-week turnaround or something like that, and we'll be good to go.
Awesome.
Because that'll still be in time. Is it the 23rd?
I think just as long as you're set to go on July 1.
Okay. Okay. Yeah, we'll keep an eye on that. We'll keep our finger to the pulse and make sure that maybe if there's some way we can fast track that, but I don't think it'll be an issue. But we'll keep an eye on it.
Sure.
Okay.
I'm really glad you're interested.
Yeah.
And Patty, are you with the Ascension clinics?
I said
Okay, yep,
yes.
that's okay. The other thing we, kind of thought about with this was around, if it was going to be one application per organization or, one per site. And I think we sort of landed on, because it's a smaller amount of money that, probably per site makes more sense. So do you have a sense whether all of your clinics are going to be interested in applying? Okay. So we may need to, I guess our understanding is that the clinics are registered through the Department of Health's program by clinic. So we may need to, can we reach out to you, or do you think there's someone better that we should reach out to at Ascension to sort of understand the best way to work with you all on this? And while she's replying, hey, Richard, glad you could join us. Hope you're having a good Friday.
I'm sorry. This is Richard. I just got another call. That's why I haven't been able to respond here for the last few minutes.
That's okay. Glad you're joining us.
Thank you.
All right. Thank you, Patty. So, Ginger, maybe follow up with Kristen or Jen or both. I know we have Jen's email address. I don't know if we've got Kristen's, but
I don't think so either.
maybe start with Jen.
Okay.
Might help just to set up a call with her and kind of see how to best approach it.
Absolutely.
Thank you, Patty. Appreciate it.
Thank you. Are there any other comments or questions? I just want to apologize for the technical difficulties that I had this morning with the presentation. It was working fine before I started. I don't know what happened. Okay. Well, I want to thank everyone for tuning in today with us. And if you have any questions that you think of after our meeting, please feel free to reach out to me by phone or email, and I'd be happy to answer any questions that you have. I hope everybody has a great weekend and enjoys the sunshine. Thank you so much.
Bye, everyone.
Bye-bye.